Welcome back to the ACSI podcast. That's the Academy of the Clinician-Scientists and Innovators podcast. In this podcast, we speak with scientists and innovators across the clinical spectrum to find out about what makes them tick. Today, we're continuing the theme of mentorship, and we have Professor Tey Hong Liang from the National Skin Centre. Welcome, Hong Liang, back to the podcast.
Thanks, Etienne. Great to be here.
Just to do a disclaimer before that, Hong Liang is actually my mentor for my transition award. So thank you very much for speaking with us today.
Sure, thanks. No, thanks for inviting me.
Yes. Okay. So maybe just to start off with, Hong Liang, maybe you can tell us a bit about how you decided to go on the path of clinical research.
Actually, after my exit from dermatology, that means I finished my training and became a dermatologist. So I got actually very frustrated in the clinic. Why? Because every day I was just apologizing to patients and saying that, sorry, we can't do much for you. This is only things that we have in the medical literature, and this is what we can offer. But deep down inside, we know we can do much more. We can improve much further and to create a better, much more better outcomes for the patients. So I think we're shortchanging ourselves. So I think we should be actually heading towards this effort to not just be happy with the status quo, but realizing that we can actually help them much better. And with this clear outcome in mind, I thought, how can I actually go about creating this improvement in clinical outcomes for them? And research is the first step. Yeah, and research itself is not a means to an end. The end is actually improvement in the way that we are able to treat and improve what patient is experiencing. So research is the first step, but subsequently we also have to think about subsequent steps in achieving this final goal.
Yes. The list of your accomplishments is actually quite long. These include things like amazing products such as Subam, and right now you're actually testing an RNA interference patch for keloid scarring, for post-surgical scarring. Is that right?
Yes, that's right.
Yeah, and I know the research environment is very different now than it was when you first started. Can you just maybe tell us a bit about the obstacles that you yourself encountered back in the day when you decided to embark on this clinical career path?
So the first most important difficulty was that there was no pathway. There was actually scarce clinician scientists around, and to me is that I can only see, like say I obtain this grant, I get a few years of a pathway that I can work on research, and then subsequently what's going to happen? I'm going to fall off the cliff. It's just like asking somebody to jump when they can't see where's the bottom. So that was actually a clear and present danger for anyone who wants to commit to this pathway. Uh, but then I going back again, right, to say that, okay, if I have to achieve this outcome of improving clinical practice, then I think there's a certain amount of risk that I have to take. I have to try to walk the path, explore the pathways, and then hopefully by opening these pathways, it can serve as a viable pathway for others to actually follow and make it easier for others also.
Yeah, so you were in an environment where you couldn't find suitable mentors, or you didn't have a lot of role models to look up to. Did you have anyone you would consider an early mentor for your clinician scientist career?
Actually, what made the huge change was that when I went for my fellowship in the US, so initially I applied for a clinical fellowship, but my mentor over there said that, if you are not coming for a research mentorship, then you do not bother coming over.
Oh, no.
So I reluctantly said, okay, acceded to that. Said, okay, yeah, I go there and I have a try. And it really kind of opens my eyes going into a different environment that actually with a very good mentor, it really opened up my kind of perspectives and allow me to see what is beyond, what is available, what are the possibilities. So even when coming back to our environment where there are no precedents, no dermatologists being clinician scientists, there are no structured pathways, but knowing that, what am I going towards at the end and the possibilities are there, actually is a form of a lot of motivation and support internally for me to carry on.
And this was Professor Gil Yosipovic, Dr.
Professor
Gil.
Professor Gil Josipovic, yeah,
Yosipovic, yeah, sorry.
yeah.
And he helped you embark on this path of researching itch, is that right?
Yes, he's the world expert in itch, and then he was actually the pioneer in this field.
I mean, obviously, you do think that mentors for clinician scientists are very important. What do you think are the main challenges that you face as a mentor for clinician scientists or people who are interested in doing research these days?
Okay, so I think as a mentor, we must sort of firstly realize that why are we going to do this and what are we supposed to do. So I think that the importance is as a mentor is twofold. Number one is as a role model to actually teach the nuances of doing research and how to be a clinician scientist. And these are the soft skills that one cannot learn in the literature or from ChatGPT. And secondly, importantly, as a coach for a long-term personal development of the person itself. These are the two main roles I see for being a mentor. Now, in terms of the difficulties that you mentioned, yes, throughout this whole process of this very special research, clinician scientist research pathway in which is neither clinical nor research uh, alone per se. This is like a combination. It's like kind of a not very well charted pathway. I think the mentee will have faced a lot of issues along the way. Yeah, and so that's where I think the mentors really come in. Firstly, to serve as a role model, and then secondly, is how to develop the person capability and the character, more importantly, the character of the person to chart a longer term career pathway. And then this will help maximize the potential of the individual and guide the individual towards a longer term goal, which a lot of young people will not be able to see. When we're young, all we can see is short term goals. So I think providing this perspective is very important.
Yes, I totally agree. I mean, this is especially more important for the young doctors or even the innovators, even before they even start on the career, not even the early career scientists, but those who are even trying to decide because they want to make sure that it's worth their time. Have you met any of these young clinicians or young researchers who are on that cusp, and how would you counsel them?
Yeah, so I think some people they actually thought that our research is part of career advancement plan, and getting a mentor who is famous is again part of this career advancement plan. But I think these are all very short term. What is more important is why one's longer term or even lifelong goals. And that is going to carry the person throughout the years and many years. So I think that part we have to help the person discern what do you want finally, what is your direction. You can't see at the end of the path where you are going to be, but you must have a good idea of which direction you want to go and what you hope to achieve, say 5 years down the road, 10 years down the road. Yeah, and I think the person knowing as what they actually want, and then that's going to last them through the ups and downs in this pathway to have this resilience and to have this motivation to carry through. If not, um, some will just die out pretty fast.
That's actually very insightful, and maybe we can turn it on you, Prof. Tey. Can you maybe let us have a little insight about what drives you and what do you think you will be able to achieve in the next 10 years, or you hope to achieve in the next 10 years?
Yeah, so it's pretty clear to me that in the end, just like I told my mentees that, in the end, what do I hope to have in you? What do I hope you to be? As long as you are somebody in this profession that you can contribute significantly back to the people and society, I think that's the eventual goal. Whichever type of research you do, the twists and turns that you go along to the research pathway, it is okay. I mean, as long as you reach this final goal, because we really want to tailor the path of the person to the individual and not tailor the individual to my own experience and my own perspective.
Mm-hmm.
For myself, I think this is quite clear that at the end of the 5 and 10 years, I really want to see that I can actually provide the benefit to not just people in my clinic, but people in my communities, country, and also other parts of the world. Sort of a proof of concept that we make initially to see this possibility and also further expansion into international markets in terms of our service and products really kind of gives us this encouragement that we can even do this more and more. I mean, we will fail some along the way, but we will have a good possibility of success, and I think we are going towards that. So this is actually what I see myself going towards, and I hope to also let other people know that this is the ultimate goal that one can perhaps look towards.
Well, okay. I think it's safe to say, Hong Liang, that I think you've well achieved almost all of that already. So I would like to congratulate you, and I think you've been doing quite amazing things for National Skin Centre and the dermatology specialty in Singapore as a whole. You've been a real inspiration for me, and I think for a lot of my peers as well.
Yeah, definitely a lot of things to be further improved. Yeah.
Okay, so thank you so much again for coming and sharing today, and thank you again for sharing your experience with us.
Yeah, thank you, Ethan, so much for doing this podcast, and I think we can certainly attempt to help more and more people embark on this pathway.
Okay, thanks, Hong Liang. Bye.
Thank you. Bye-bye.
Okay, bye. Thank you for listening to the ACSI podcast. If you want to reach out to us, our email is in the description that accompanies this episode, and you can get us on all your podcast programs, including iTunes, Spotify, and Pocket Casts. Thank you, and I'm Dr. Etienne Wang, and I'll see you next time.